Hi,
Hello.
how are you?
Good. How are you?
Welcome. I'm juggling my juniors from the other class. They're coming in.
Okay. No worries.
Probably another minute or two for everybody to
Oh,
be.
okay.
How are you today?
Good.
We're excited
It's
to meet you.
Friday. Yes, exciting to be here.
Okay, so I think it's just going to be us.
Okay.
The other teacher's not going to be joining us, so
Okay.
we'll have a couple of stragglers.
All right.
Um, my name is Marcita Kinlaw. Miss Pena is out today, so she made me the host. But this is my beautiful American literature class.
Oh, well, perfect. Well, my name is Briana Glover. I'm a pediatrician. I work at the Children's Healthcare of Atlanta. We have a few campuses downtown. We have a hospital called Hugh Spalding. I'm currently at Eggleston Children's Hospital, which is in the Decatur area. And then we also have Scottish Rite. That's kind of up north, kind of towards Buckhead area. We're employed by Emory though, School of Medicine. So that's why you see like on my white coat it says Emory, but like clearly we don't go to like the adult hospitals for Emory. We stay with the children. So very happy to be here today and meet you all. Anytime I can get people that look like me in medicine, I'm very excited about it. So the questions that I had received was what drew me to my career. So actually, when I was a little kid and going to my pediatrician, like in the third grade, I was like, I want to be a pediatrician for some reason, even though that's not even the style and the practice that I want to do right now, because that was just like my, like where you go for like your well child checkups. But I just liked it. I got like a sticker at the end. It felt cool. And then I just kind of kept saying like I wanted to be a pediatrician until it happened. I went to the University of Georgia for undergrad. So right after I graduated from high school, I actually went to high school at MLK in Lithonia. And after I graduated high school, I, went to college. I majored in biology and psychology because at first I did have like a brief change in thought that I might want to be a child psychiatrist and take care of, kids that are struggling with like mental health issues. But all in all, I still came back to the same old pediatrician thing. So that's how I ended up here. Just kind of randomly said it when I was very little and kept going. The next question was describe a typical day at work and how many hours do you work each day? So this can vary. The field that I'm going into is called pediatric hospital medicine. And so you have weeks where you're on service, quote unquote. Those weeks are longer, like you work 12 hours pretty much every single day, seeing those kids that are admitted to the hospital and trying to figure out what's wrong with them and, getting them home, consulting other specialists to see, what's wrong with them. But then on my weeks that I'm not on service, it's like a typical work day, kind of like, probably y'all's parents, like 8 a.m. to 4 or 5 p.m. That can vary though within medicine. So say you did want to be like a primary care doctor where you go for like a regular pediatrician where you go just for your checkups. Full time for them is 4 days a week. And so those hours, still a little bit longer. Those are typically 10-hour days when you're working 4 hours a week. So you may see your first patient around 8 and not get out of there till, like 6 p.m., but still not overall a bad day if that is, what interests you. So it's very different avenues you can go within medicine, and kind of your hours and lifestyle can affect kind of what you choose. I'll give another good example. For emergency medicine doctors, their lifestyle is also completely different. So they do what's called shift work, where they do 8 or 10 hour shifts, but it can be any time of the day or the night. So as you grow older, and some, especially women, like you want families, a lot of those women doctors that are moms will work at night. So they'll come in and work 11 p.m. to 7 a.m. So then that they can still be home during the day, and participate in their family. So it's lots of options out there, but that's kind of my day.
Quick question. So, general pediatric care versus pediatric hospitalization.
Mm-hmm.
How are they different?
So the general pediatric care, that's like the outpatient clinics. So where you take your children for, like vaccines, well child checks, if they just have, they stub their toe, a simple cold, that kind of stuff. And then all the other specialties are either kind of in the hospital or they have what's called like subspecialty clinics. So for hospital medicine, I just stay in the hospital. So I won't see you, unfortunately, unless you need to be admitted into the hospital, and then
So
I'll
it's
take care of you there and help
okay.
figure out what's wrong with you, and then hopefully get you home. Of course, that would be the goal.
So it's like the pediatric emergency room.
Yeah, so the patients get admitted, yep, to the
Okay,
hospital.
got
They go to the emergency room, and so you can be an emergency room doctor where you just see the kids in the emergency room and you decide whether they need to be admitted or go home. And then I'm the doctor that you come to if you need to be admitted to the hospital and stay overnight.
gotcha. Okay.
Mhm. So how much time did I spend in school to prepare for my career? So I did high school like y'all. Let's see, I did 4 years of college, 4 years of medical school, and 3 years of residency. And it sounds like a lot when you say it like that, but it's not. It goes by super quick. And I think you get the break because after you graduate medical school, you are a doctor. And so you can refer to yourself as that. And so I was like 25 when I graduated medical school. So it doesn't seem like that long of a time when you think about it in the grand scheme of things. Like at 25, I could still say like I'm a doctor, but you just do have like additional training. But it is worth it. Do not let that deter you.
The residency, it's considered formal training. Is it the internship?
Yep.
That's
So your first year you're called an intern, and then your second and third years for pediatrics specifically, that's when you're called just like a second year resident or a third year resident. And so yeah, so after you graduate medical school, you are a doctor, but you have to go through training, in whatever field you want to do it in. And some residencies can be longer or shorter. Ours is the kind of the shorter end at 3 years, but you have like residencies like surgery that are, several years. So it's just time spent in training to really, of course, when you get out on your own and you're practicing, you want to make sure you kind of know what you're doing. So you get paid during residency. You do work harder in residency than you do once you're finally out on your own. But yeah, that's that formalized kind of job training. On the job training is what residency is essentially. And then after that, you can go to fellowship to subspecialize in things. So after you graduate residency, you are like a general pediatrician, but I'm actually going to continue my training and go back to what we then call fellowship, which is just a fancy way to say I'm going to subspecialize in hospital medicine. So that way, like I'll just basically just more certifications. Basically, you can think about it like that. What did you like the most and least about your job? So the most about my job that's super is easy. Like I love kids. They're super resilient. I like the disease processes. So like they're presenting with these symptoms and you have to try to figure out what's wrong. So that's kind of it can be fun. That probably is also the most challenging part of my job is if we do have a kid presenting with all of these symptoms and we can't figure out what's wrong after we're doing all of these tests, doing all of these imaging, all the stuff you've studied they're not fitting, all the things that you have studied. So that can be frustrating, or like if they're not responding to the therapies like you would want them to, that could be frustrating. Or of course, like breaking bad news, like telling families that, the kids have cancer or things like that. Of course, that's not fun, but overall my job is super super fun. Like the kids are very cute, they get better, they're super resilient. The skills that I need to have to do my job, so I guess I would say of course logic, like you have to be willing to have that like investigative nature, communicating of course with, especially in my field, because our patients are taken care of by the parents, so you have to communicate with what we call like two patients essentially, versus if you choose to take care of adults, you're kind of just having a one-on-one conversation with them. So making sure you're being clear with your communication to the parents to kind of figure out what's going on with the child and talking to them about what's going on. And then of course, patience, I think, is really great to have in medicine. Patience in all areas, like patience when you're dealing with families, patience when, even with like how long the process takes. I think just patience overall is good. let's see, do you get any good advice from anyone at your job and outside of your job? So yeah, I've had mentorship kind of throughout, and I would advise you all to get mentors early on. So for whatever you want to do in life, after you go to college, if that, that's the direction you want to take, I would encourage you to, seek people in that same field or like doing what you think you would want to do, and just talk to them honestly about it, because that honestly helped me the most kind of persevere and figure out kind of what I wanted to do long term in my career. So yeah, advice is everywhere. There's also bad advice out there, so be weary of that. But there's people out there that would love to mentor you all and help you all in whatever field you choose. And if any, I'll give y'all my information if any of y'all want to contact me for, let's see, have you had any problem trying to achieve this goal? So I mean, yeah, it's not an easy journey. You'll learn that the classes get harder. Like high school was, okay, and you're happy, you go to college. It's a different level of academic, more so pressure, but it's definitely doable. I feel like all of us are smart. You just have to apply yourself in ways that you did not know you could apply yourself. So it stretches you a little bit, but I think you grow even more from that stretch of feeling that stretch. And then also you have this long-term goal of you want to be able to take care of, patients. And especially like we don't have a lot of physicians, that look like us. So I feel like that was always my motivating factor too, is I wanted to be able to know, just as much as anyone else knew about whatever disease process was going on, and then to be able to translate it and explain it in a way that makes sense to all families, from all backgrounds. So there's problems. It's definitely not like easy. It's not going to be like, oh yeah, I'm just going to go, ride a bike. It is harder. And then the degrees. So you get your high school diploma. Then after college, you get, I got a Bachelor of Science, but you don't have to necessarily get like a Bachelor of Science. You can get your degree in actually anything you want to in college. And then after that, you go to medical school and you get your medical degree.
I have a quick question.
Mhm.
Where did you go to undergrad, and do you think once you got to medical school, did you think, okay, yeah, I'm really prepared? Okay.
Yeah, so I went to the University of Georgia. I was very stretched there. It's a big public institution where you're kind of like one of a number. And so when I got my like first bad grade as a freshman at University of Georgia, and you learn that you have to kind of be your own best advocate. Like you have to, I feel like when we're in high school and under, it's like, your parents are always pushing you and getting on you about making good grades. But when you're in college, you truly do kind of have to shift your mindset, because you're truly like an adult at that point. And nobody's going to make you go to class or make you study those extra 2 hours that would have, made the difference between a B or a C on that test. But I do think, after going to the University of Georgia and like getting through it, um, it was great. Medical school was much better. I did feel prepared. You're still learning new things, of course, in medical school, but I feel like the main thing you have to learn is, how to study, what works for you to retain information and truly learn. And so I think that was the biggest stretching process that had to occur when I was in undergrad. Because I mean, I was young, just like you all. I was 17 at UGA. So yeah, it's just a shift in mindset that has to occur, but will occur. Have I ever got sick from a patient? Yes. So before COVID, there were regular germs that kids have. I don't know if any of you all have like little brothers and sisters, but they frequently stay with a runny nose. So I had a lot of colds when I first started like my formal training and residency. A lot of, other than that, a lot of infectious diseases, we make sure to be careful. There are some diseases that, of course, can, like COVID, for example, that can be transmitted by respiratory droplets, but we're very careful. The hospital is very careful with, like using contact droplet precautions. So you'll wear your gown, you wear your mask in the rooms that are deemed, necessary for that. So I've never gotten a serious illness from a patient, but definitely like my fair share of colds. And then if I had to do it all over again, I would definitely choose the same career, even though, of course, as I said, it has been a lot of stuff that has kind of gotten in my way. But, you make it through and it's super, super fun on the other side. So it's definitely worth it. Did you learn about the Henrietta Lacks in your preparation courses? So I'll actually say no. I did learn about it through the book and then the HBO movie that Oprah starred in. So unfortunately, I guess probably not surprising, kind of like that Black history type things or education is not taught in mainstream kind of medical classes. But as you know, Henrietta Lacks did contribute a lot to science. Her cells were unfortunately taken like involuntarily from her, and found to just replicate, and then has actually been used for some great things, like, testing those, using those cells to test vaccines or to find treatments for cancers. But, of course, it was sad that that occurred without her knowledge. And I think since then, the medical field has put in a lot of rules and regulations. So when we are doing research on patients, you actually have to get it approved through what's called an institutional review board, or IRB. So that happens on every single research project now. And then, of course, we do use what we call informed consent for patients. So we actually tell them, what will happen with, their tissues or organs, those kind of things. And then you can give them the choice. So they should know fully what is happening to them medically. So I think that has actually been emphasized. I do think people in my field acknowledge like the unethical nature of some of the things like Henrietta Lacks, and there's unfortunately many others. So it's not like it's not acknowledged, but you don't necessarily learn about it, in a routine textbook, kind of how you learn about asthma or, some other disease. How has it been working through COVID? Lots of kids infected. So COVID actually spared the pediatric population a good amount. So our census is just now picking back up. It went down pretty pretty low actually, like once the schools were out and the germy kids weren't sharing their germs, and I think a lot of the parents were sparing the kids from being exposed to it. We did not see a lot of cases. We had a few cases. For months it was only like, 100, couple of hundred within our whole system, within the whole Children's Healthcare of Atlanta system. Y'all have probably heard on the news about this like multi-inflammatory disease in children called MISC, maybe not. So we have seen that is where the kids get COVID and then they heal just fine usually, but then afterwards they have kind of like systemic inflammation, so inflammation throughout their whole body. We have seen a good amount of cases about that. So we've had to adjust to getting used to that being kind of on our radar as a diagnosis. But for the most part, I can say like the numbers that have been at the adult hospitals have not been as much as at the pediatric hospitals. And overall, kids have done just much better than adults, which we don't know why, but it has been. Let's see, what is my definition of success? I feel like success can be whatever you want it to be. When I think about success, I think about what is driving you, like what is your passion. So I always tell kids, you don't have to do like what I'm doing. Like you don't have to become a doctor. You could is plenty of trades that may motivate you, and that be your primary passion in life, or you may want to be an astronaut, a lawyer. Like I feel like just find that something that's worth getting up for in the morning, and I feel like once you are doing that, I feel like that is success. So not, of course, not settling for less just because you feel like whatever, like I'll just do this. But I would just encourage you to find, what do you think you would like to do? Like every single day for the rest of your life, you wouldn't mind getting up and doing it. Like even like, so from some of my cousins, they're boys, but they like love video gaming. So I'm like, okay, long term, what do you think you would want to do? Of course, not just play video games, but how about making the video games and being, a video game engineer? So just thinking about ways that you can use what you do like to do and doing it. One of my cousins at one point, he's in high school, he was selling like, donuts and chips, I guess, and stuff when y'all were in person. And it's like, okay, if that's what you want to do, then we need to teach you how to be like an entrepreneur and, figure out how to sell and make, other things work for you. So yeah, the success is literally how you define it. But I would say I view it as, following your passion, like that true drive. And that's different for everybody. And then what are some things I do to calm children and parents in the hospital setting? So kids, that's easy. Toys, rocking. We have like playrooms. We have what's called child life specialists. They come around with video games, the Wii stuff. So the children are great. And then for the parents, I feel like most of the times when they're anxious, that's when the communication does come back at play. Because any parent who has a child admitted to the hospital is automatically thinking the worst. So kind of setting those expectations, and maybe the worst is to be expected. Like we definitely have really, really sick kids in the hospital. And, just explaining what is going on a day-to-day basis with their child, I feel like alleviates anxiety and letting them ask questions. That's the main thing that I do kind of pride myself on is when I'm going in the room, I'm explaining to parents or kids if y'all are old enough to understand. So once you're about 14, 15, we'll start including the kids in on the conversations too. And just being open and honest and trying to see what do they want to know, what is going on, and letting, those questions come, because you don't know what they don't know. And then in their mind, they're probably thinking the worst, automatically. So just trying to balance that and explain things, I think helps a lot. And my future goals, I want to practice hospital medicine long term, but also I'm doing a lot of work and research as well. So I've done some research on asthma and like what medicine works best for kids having an asthma attack. I've done some work about organism called salmonella that you can get from turtles, and it causes like diarrhea and stuff. So I've done some work on that and how long we need to treat those patients with antibiotics. And then I've also been working on increasing like underrepresented minorities in medicine. So when I first came to my residency program, out of a class of 28 of us, I think it was 28 of us, it was only 2 Black females. And that was really rare for, we're in Atlanta, it's very diverse. So with that, I've been very involved in the formation of a diversity committee, intentionally recruiting applicants, graduates that have graduated from medical school, like recruiting them to come to our residency program. And then also the education of all of the physicians on like sometimes we can have implicit biases and think ways that are not that great and can actually negatively impact patient care if you have these biases that you may not even recognize. So I've done a lot of work on developing a curriculum that also talks about implicit biases and those kind of things. So those are kind of like my 3 things. So I would imagine myself, doing some weeks on service where I take care of kids, having some weeks where I do my research, and then continuing to be involved in just trying to recruit underrepresented minorities in medicine. And I think it was a previous question about that. Yeah. So I was asked, are there many Black women who work in my field? There's about 11% of physicians who identify as either Black or Latinx. This is pretty not great. As the total census in like 2019, Black and Latinx people represented about 32% of the population. So ideally, your physician workforce would look similar to like, what your overall population looks like. And we haven't got there yet. In my program, though, like the amount of Black and Latinx people have increased because we've been, of course, constantly working at it now. Have you ever encountered or witnessed discrimination on the job, and how did you or others respond or overcome it? So I feel like the only discrimination comes in the form of what we call microaggressions. That's kind of like the word in the literature about it, where you have these small, subtle comments or like subtle experiences that are insulting, and it kind of puts down an already like minority population as we're like interacting in the medical field. So I would say, for example, for me, I'm often mistaken for the nurse or the janitor when you're walking into a room and introducing yourself. And of course, there's nothing wrong with those professions at all. Like those are, great professions, but it does hurt sometimes that, no one ever is going to assume that, you're the doctor. So those kind of microaggressions, I feel like that's what probably be the most that occurs on the job. I feel like the way I've overcome that is just with education. So when I walk into the room, explaining who all is there, like, hi, my name is Dr. Glover. I'm the supervising physician over the team, and then introducing like the residents and just making it known, like, hey, like I am your doctor, and just making it clear. Because I think it's just truly like I just said, it's only 11% of practicing physicians that do identify as Black or Latinx. So it's a small number of us. So people don't automatically assume like, yes, you're a doctor. So that kind of stuff can be frustrating. But I've yet to experience any like overt, frank discrimination. Oh, have you ever had to deal with parents who could handle the talk? Definitely yes. So I think we call it, the fancy word of it is like health literacy. But I do think that, yes, it can be low, especially in the population we're serving. Again, that's where I get to the point of having the parents emphasize to me what they heard me say. So I'll go in the room, I'll talk, and I may think I'm using, the simplest words, which us doctors have a hard time using simple words after you learn all these fancy words that mean the same thing. So after I, talk through like what we're going to do with the patient, what is the diagnosis, what does the treatment involve, I often ask the parents to repeat it back to me so I can see what they did understand. And then if they did not understand it, then we work on other ways for them to understand it, whether it's like drawing it out, like drawing a picture for them. A lot of our kids go home on a lot of medicines. So sometimes we'll take the time and make like medication charts. So you have like, on Monday, to give these medicines at these times. And on Tuesday, to give these medicines. So we do whatever works for, our patients. Our patients come from, all different kind of backgrounds. So I never personally assume that they understand what I'm saying. So what is my childcare philosophy? And if someone is pregnant, when is a good time to start looking for a pediatrician? So I guess for the latter question, it's never too early to look for a pediatrician once you find out you're pregnant. I think being prepared throughout your pregnancy is good for most moms to know where they want their child to go, what hospital they want to go to, what birth plan they want to use. There's plenty of options within all of that as well. So I would say it's never too early to start looking for a pediatrician. And then I don't know what you mean about my childcare philosophy.
Meaning, like, what do you if you're taking care of a child, what do you expect?
What would I expect from like the kid? Or
Mm-hmm.
so I guess I don't expect a lot from the kids. So depending on your age, of course we cater our care, I feel like, to whatever age you are. So like, all of you are older. So if you came to a doctor, a pediatrician, we would make sure like separate you from mom and talk to you alone and, treat you as an individual, even though, until you're 18, technically you are not an adult, you're still a minor. But we do try to make sure that the children do feel heard, as often. It is, y'all's body, that kind of thing. And then the little kids, they're easy because like the babies and the toddlers, they just run around and play. And so a lot of it is talking to the parents to figure out what made them come in, while the children, like the really, really tiny children, just they do their own thing. And the most satisfying thing about my job is probably interacting with the families, and seeing the kids get better. I feel like the kids are super, super resilient. So they come in, they're not wanting to play, they're looking very sad and sick. And so seeing them get better is like the highlight of it all. And I think that helps the parents as well. So talking to them through the process and then seeing the kids look better, that's the best part. And then misbehaving kids, I don't really know if you can misbehave in a hospital. You know, like they're sick. Yes, sometimes they have attitudes with us, but I mean, if you were, if you were sick and vomiting or couldn't breathe, or if you were sick in any way, you probably wouldn't have the best attitude either. So I wouldn't say probably necessarily misbehaving, but yeah, we deal with it all. I feel like pediatricians, we're very like adept at like kind of just filling out the room and meeting patients where they are, because often the toddler is one way screaming, the mom is nervous over here. So just kind of adapting yourself to that situation. And then, no, I actually don't have any physicians in my family. So I had to figure this all out. I wouldn't say like on my own, but kind of through the help of mentorship. It was a lot of things I did not know along the way. But I just knew I wanted to do this. My mom helped a lot, just researching on the internet, like, what do you need to do? By the time I got to medical school, though, I would say I had some pretty solid mentors. And then especially now, I have some pretty solid mentors to help me plan my career, or for me to ask the crazy questions to, because no question is dumb, because we just, when you're not exposed to it, you just don't know. And it took me a while to get comfortable with that fact as well. But now I feel like I just ask all of my questions and let my confusion show and get the best advice I can. So yes, I'm the first doctor in my family. Everybody else does like banking or insurance, that kind of stuff.
I want to ask about your work-life balance. Like, you're relatively young, right?
Mm-hmm.
So what is it like being a doctor and still having a social life?
Yeah, so I feel like social life was not an issue in undergrad or medical school. Social life was harder in residency, but it's only for 3 years, just because you are working like those long weeks. So residency is a time where it is on the job training. And so essentially you have to be on the job a lot to learn how to do the job. So that was harder. You still get like, some weekends off, you still get like some vacation weeks, but you have to plan it a lot better while you're in residency versus medical school and college. It's still more so kind of like high school, but just like high school times 100, because the stakes are higher, but you still have time to see your family, study, go hang out with your friends, go party. You have time for all of that in college and med school. But residency is a little bit harder, but that's the only part that I would say it was hard. But since then, now I feel like I have a great like work-life balance. And in medicine, we actually try to call it work-life integration, just because, you're probably never going to get the true, depending on what, where you go. Like I say, if you want to just have your own practice and do well child visits, those kind of things, it probably is a more quote unquote normal lifestyle. You work 4 days a week, about 10 hours a day, have most of your weekends free and those kind of things. But for the career path I've chosen, I've already acknowledged the fact that, like, yes, I am going to have those busy weeks where I'm at the hospital for 12 hours a day. So of course, after you're there from 7 a.m. to 7 p.m. is not a lot that you can do afterwards. But then I have those easier weeks. And so being intentional about what makes you happy and like what goals you want for yourself, I think that's important when you're trying to get the whole work-life balance thing in medicine. But post-residency, again, like, it's not a problem. Like right now, I'm buying a house, which is exciting. So I like go look at it all the time, and I hang out a ton with my family and friends, and you have a bit more flexibility in your schedule. So it definitely works whether, you want a family long term, whether you just want to go travel the world long term, it works. But I will say the hardest part is in residency. That was the first time where I was like, okay, I'm young and I'm at a hospital like all the time. But I didn't feel it outside of that. How do I deal with emotional trauma inside the hospital? So yeah, we do have a lot of sad cases with kids sometimes. We have networks set up in place. So of course you have like your colleagues. So after there is a bad outcome or a bad situation that comes in, we do debrief and, walk through processing what just happened, things that we could have done better in the moment, things that did actually go well, acknowledging those things that went well as, that's important as well. And then kind of just debriefing about like the emotions of the situation and what all aspects went into it. And then more formally than that, we have like a physician support program that will actually reach out to you when you have had like a patient die or a patient with a bad outcome. They will proactively reach out to you. So that's also a help. And then throughout, once you become a doctor, there's access to free counseling services for pretty much from the time you become an intern and in residency. It's a lot of focus on mental health in being a doctor, and also burnout, because as you can imagine, kind of dealing with those harder situations long term could be harder. So there's a lot of research and focus in the medical field about like how do we combat this like emotional fatigue. So yeah, I think it's about making sure, checking in with yourself and making sure if you're okay or if you're not okay. I feel like the only time I was actually not okay was when I was in medical school, ironically, because I guess I didn't say this. I went to the Medical College of Wisconsin. And so I knew nobody in Wisconsin. That's just where I went. I ended up there. Like I applied to, like I say, I was the first physician in my family. So I applied to, 50,000 medical schools, felt like, interviewed at them all. And then that was kind of like the best fit that I felt for me. So there I went to Wisconsin. That was the only con. Like it was cold, it was weird, it was far. So that was hard, of course, experiencing everything and being so far away from family and friends. But yeah, I think, and this is like no matter what field I feel like you go in, making sure that if checking in on your own emotional well-being, and if being okay to say like you're not okay, especially with COVID. I'm like, this social isolation, everybody's just in their houses all the time, can't really do the things you want to do. It's just hard for everybody right now, especially.
Have you developed like a special skill or talent since you've been cooped up outside of work?
No, I was cooking a lot, so I know how to make a very, very great homemade pizza. But like, yeah, the weight started creeping up, so I must not do those anymore. So I'm currently avoiding that. But I cooked a lot in quarantine because basically I would go to the hospital, come home, like shower real quick, change my clothes, and then like cook. It was not great. But I did also take up nature walking. So now I've just shifted. So now I like walk the trails, like behind Georgia Perimeter. Well, what used to be Georgia Perimeter, Georgia State. They got the Michelle Obama Trail. So I try to walk like, a few miles when I can, just to get outside and do something safely, socially distanced. And I've also recently gotten my bike fixed from like years ago. And we'll see if I can still ride a bike or if that's even fun now. But
yeah. Ladies, do we have any other questions? Our time is coming to a close. We got like a minute left. No, well, Dr. Glover, I can only imagine how busy your schedule is.
Yeah.
So I want you to know how much we appreciate your spending this time with us.
Yeah, and let me drop my email.
Oh, thank you so much.
But yeah, no, thank y'all. Definitely let me know if there's anything else y'all want to know. And if we would have had more time, I would have asked what y'all were actually interested in like a career. But yeah, let me know. I'm here to answer all questions. Like I might not get back to you immediately, but I will get back to you definitely.
We appreciate you. Thank you so much.
All right. Thanks. Have a good one, guys.
Bye.